And today, it's an honor to get to introduce Paul Perez, who's with us today. Paul is going to be speaking about the New Mexico Health Exchange and healthcare for small businesses. He is a senior outreach manager with Be Well New Mexico, and he is so overqualified for this, it would take the next 10 minutes to go through why Paul is so overly qualified for this. So with that, he actually lived here for, you went to high school here for a year, right?
Yeah, middle school.
Middle school, okay, great. So he's familiar with Los Alamos and everything that is Los Alamos. So please join me in welcoming Paul Perez.
Thank you. So thank you so much for having me. We're doing Mass On. So am I clear enough on this? So it's a pleasure to be here. I come from Albuquerque. I'm actually an employee of the Albuquerque Hispano Chamber of Commerce. So we're the primary contractor for Be Well NM, the New Mexico Health Insurance Exchange. And so we travel all 33 counties, every small town, every pueblo, as well as our Native American lands. And we do outreach also to our immigrant population, which just isn't Hispanic. We have quite a diverse state. We have immigrants and refugees, asylees from all over the world. And we're able to outreach to them to ensure that all New Mexicans have access to health care. And through the time Be Well NM has been here for many years, this has been an unprecedented time because of the pandemic. This has enabled us to reach more people, believe it or not, through a lot of Zoom and a lot of coalitions, a lot of chambers of commerce like yourselves, the small business world. We're looking at other ways also through economic development is how do we encourage people to come back to work? How do we keep employees? How do we maintain our employee base and the bottom line? And what we'd like to do is present this as a help to small business because as we all know, and we were just talking about this a moment ago, myself and the counselor were speaking of a health plan and benefits. The benefit of a health plan is a great recruiting tool to bring people in New Mexico. There's a lot of people that don't have health insurance that you think would have health insurance, and I'm going to talk a little bit about that also. So important health insurance information here at Los Alamos Chamber, and I've got the clicker, which is great. And so we're a Small Business Health Options Program, SHOP. You'll hear me say SHOP a lot. That is a Small Business Health Options Program on the marketplace health insurance. So Be Well NM, you'll hear us talk about Be Well NM, the New Mexico, or the New Mexico HIX, the New Mexico Health Insurance Exchange, also known as the marketplace. And what's a wonderful thing is I like to profile marketplace because once we get into this, and our topics that'll be covered is when a broker, and I'm always going to be talking about brokers and agents. Brokers and agents are completely free of charge. All our services through Be Well NM are free of charge. We have brokers, agents, and enrollment counselors who are there to assist. And I'm going to be talking a lot about the brokers and agents because in the small business world, not everybody has an HR or that kind of admin department that's going to handle a health plan for folks. And the smaller the business, there's going to be some other options also, and also for our nonprofit world. Benefits of offering health insurance to small business basics. We're going to go over budget. Is it budget friendly? And that's that's the individual. None of these plans are cookie cutter. In fact, on the marketplace, when we go to free help, what a broker can do, an enrollment agent, and a counselor, is they're going to be able to bring up the 4 plans, and we'll discuss that in a minute. And the 4 plans, it's kind of like shopping for a plane ticket. I'm going to Dallas. I go on Travelocity. It shows me the least expensive and what the benefits are, all the way to the most expensive. And usually those are based on time, but this is going to be based on the 4 metal levels. And what it does is on the marketplace is, along with that, the individual is going to see the price of what their premium, their monthly premium is going to be, or their annual premium. And it's an awesome way to shop. it just kind of, it takes a lot of the guesswork out of it, and the brokers can do that for you. You can also do that online yourself, but for small business, I always recommend using a broker. Along with the free help, we're going to be talking about individual and family, which is a unique opportunity. Open enrollment is going to be commencing November 1st, and that runs through January 15th. We usually don't like to give an end date right away, but I'm just going to give it to you for small business because small businesses can enroll their employees anytime. However, if we go with individual and family plans within the small business, those start November 1st. And it's New Mexico, and it's not just New Mexico, it's everywhere. I've had the opportunity to live all over the world. If we say January 15th, everybody's going to wait till about the 13th or the 14th to do that. And that's just not New Mexico. That's everywhere. So we go with November 1st because, you know what, before the holidays, we want to capture as many people who need health care, right? The whole thing is access to health care. How do we get access to health care, ensuring that we have a healthy work environment? We're safe. It's better, again, for the consumer and the taxpayer. You're going to hear me say that over and over. And it's better for you as a business owner when your employees are healthy and safe, and it helps the bottom line. So we can go on to the next slide. Shows you these are just some benefits. We talked about the benefit, the idea of capturing those employees who have been out of work or want to come back to work and aren't sure where they're going to go, is whether it's a business plan, a shop plan, or an individual and family plan. That's what we're here to do. We're here to encourage that. You as influencers in your businesses, what we'd like to do is if you need us to, we can travel to you, we can Zoom to you, we can WebEx to you, we can be in person with you as the influencer there so that you have your employees there and we're able to explain BULNM and the healthcare options through an insurance plan to them so they can make the best decision for their family. This is not a cookie cutter program. Each individual has a different, could fall into a different category of a health plan. There are 10 essentials that every health plan comes with, and I'll cover that later. However, it's important to understand that my health plan might be different from my coworker's health plan, who's going to be different from their coworker's health plan, because all our situations are different. Strengthen the bottom line, little to no cost to business. And tax credits, that's a big thing. Tax credits are available for the small business. Also guarantees small business the ability to offer employee health plans regardless of pre-existing medical conditions. I had an opportunity to speak to a man recently who was diagnosed with cancer. He had a private insurance company. He was dropped. And he came up to us to give us his testimony of he went through the HIX, the New Mexico Health Insurance Exchange, BULNM, and he was able to pick up a health plan even with his pre-existing condition, which is outstanding. We offer the plan with 10 essentials, offers choice of comprehensive health and dental plans. Small businesses, this is through private companies, but working with a broker, he or she would be able to figure out what the cost would be, what the base cost would be if an employee wanted a dental plan. Family and individual plans. Recently worked with a 59-year-old, and I'll give his information later, not his personal information, but he opted into a vision plan, which came to $9 extra a month on his premium. Participation of the employee or the employer is not required. Employees will select a base plan and give employers will select a base plan and give employees the option to choose a plan. So there's 4 metal levels, and I'll discuss that a little bit more, hopefully, if we have a little bit of time. I need to slow down a little bit, want to get it all in there, is I might choose, out of the 4 metal levels, I might choose a silver plan for my employees. And I might say, well, Jeff, you're my boss, but I don't need a silver plan. I need a bronze plan because I'm healthy and young, and I'd rather pay a lower premium and pay more if I have to go to the doctor. And then myself, Paul, might say, well, Jeff, I don't want the silver plan, I want the gold plan because I want to pay a lot more upfront on my premium so that when me and my kids go to the doctor, I have less out-of-pocket expenses. So those are just options that the employee is going to have. 24 different options each employee will have. Is it budget friendly? Small business owners can drive this. And again, this is not cookie cutter. each business owner, each employee would have to look to see what's going to be the best plan for them. What's the best option? Again, we're talking about health options and access to health care. Employers are not required to contribute to their employees' premium. That's great. However, employees can contribute either a set amount of dollars or a percentage. Employers may choose to contribute as low as 0%. Most qualifying small businesses will contribute about 50% to get a 50% tax credit from that. On our website, I haven't talked about that, BeWellNM website, it's excellent. It's been redone, refurbished, and it's new and fresh. We have the calculators on there. Very simple for a small business person to go on, BeWellNM.com, go to the drop-down menu, go to the business side, and find those calculators in there that you can calculate how much you pay. Do you offer insurance, yes or no? How much do you, on an average, do you pay all your employees? How much tax credit are you willing to, or how much are you willing to fund of that health plan? And then it'll calculate your tax credits. So it's a wonderful, wonderful calculator. The website itself is set up, it's user-friendly, even for the individual and families. I'm getting kind of used to, I'm a little bit older, but I'm getting used to the video and the YouTube and the Facebook Live. And on there, it's basically, you can go to an individual and family and run them through on a video and go to the next step, and you go to the next step, and you go to the, it's just great. It's set up great. Tax credits are available. Your employees have a choice. 4 metal levels: platinum, gold, silver, bronze. Bronze being the lowest, and we kind of talked about that. Employee must select a plan option that best meets the family budget. 24 different plans to choose from. That is going to be through True Health New Mexico, Presbyterian Health Plan, HMO, and Presbyterian Insurance Company, PPO. So within those 3, there'll be 24 different selections an employee can make as what best fits them. Let me talk a little bit about what they're going to get in that. Let me just slide to this because I don't want to miss any. I think this is important. Each plan will carry the 10 essentials. And I don't have all 10 memorized, so I'm going to just kind of read them off. Each plan, regardless whether it's the bronze, silver, gold, or platinum, is going to carry the 10 essentials, which is ambulatory patient services, emergency services, hospitalization, maternity and newborn care, very important right now, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness service and chronic disease management, pediatric services, including oral and vision care. That's a lot to cover. And I'm excited because all those things are provided in each health plan. It's just a matter of what's affordable to the client or the employee. Back to the certified broker. Brokers are great. I just was on board with a broker yesterday at a presentation, and brokers can answer the hard questions. I had the opportunity to be with the president of Apex Insurance Agency in Albuquerque. His name is Ryan Jaramillo. He did a phenomenal job because there's a lot of questions that you probably have that are financial questions or maybe some personal questions, and some questions that I've already had questions today that were new to me, and I love traveling because I get to hear new questions that I get to research. But all our services are free. That's what's important. They're licensed through the state, certified through the state. Every broker, every agent, every enrollment counselor goes through the state for licensure or certification. They can help you, educate you about your tax credits and the administration of your health plan, your business health plan. They're phenomenal at that. Again, I know that a lot of small business, you don't have that HR person. You are the HR person. You are everything, right? And this is kind of the stuff they'll help you with, life-changing events. You have an employee yourself has a life-changing event. Maybe there's a child, a death, a divorce, maybe an adoption. Any of those life-changing events. You might change jobs on a family plan. They're there to update that. New employee sign up. What's nice about new employee sign up, it's a added benefit to the employer. And I know small business, you bring somebody on and that's the person. They're going to be by your side, and they come for a couple of days and they don't come back. So as a new employee sign up as the employer, you can go a month to 60 days before you grant the benefit, if you would like. Let's say I get a new employee and I say, hey, Paul, I want to try you out. You seem like we had a great interview, and Paul comes to work and I work a week, and knowing that I'm looking, at in 30 days to 60 days, I'm going to have a health plan, and I decide not to come back to work. What's nice about that is you didn't go through all the work to get them on the health plan with a broker to get them taken off. So you can actually use a probationary period for your workers and use that as a tool, saying, hey, coming up within 30 days, we're going to get you on a health plan. These are some of the benefits, the 10 essentials, and this is what it's going to cost. And we'll work with the broker to do that. Benefit questions, huge. Mr. Jaramillo yesterday from Apex, those benefit questions that came up around the state, just brilliant. And all our counselors and brokers are trained the same. Claims and more. There's oftentimes, and even if you have insurance, you probably know this. You've gone to a doctor visit, or you've made a visit to urgent care, and you get the bill, and you look at it, and you're saying to yourself, well, I paid my copay, why am I getting this big bill? And if there's a billing question, if there's irregularities, if there's questions that need to be answered on that, perhaps somebody's getting an overcharge for their visit, the brokers can help claims and more. And that's that little HR piece. Now, obviously our brokers aren't HR people, but that's that little piece that they can handle for you as a small business. And that's important. That's important because you're trying to run the business, not trying to run a health plan for your employees. So let's talk a little bit about individuals and families. Now, not every small business is ready to go into a health plan. Hey, I'm just getting started back up post, still pandemic, but we're coming back to work, return to work. I don't need another thing on my plate because I'm just trying to make it. However, I do have employees, my family included, who require access to health care. It's a need, right? It's something that we have. So again, special enrollment is going to be open enrollment's November 1st. And this gives everybody a unique opportunity. We talked a little bit about small business, but I also want to bring up our nonprofits. I just came from a summit down in southern New Mexico that was all nonprofit. And what I found was, and I've seen this everywhere else in the Farmington area also, lots of nonprofits. They seem to be the least cared for people. They care for everyone, and they're providing services to everybody. But a lot of them are volunteers, half-time, three-quarter-time employees, probably less than 30 hours a week, maybe even less than 20 hours a week. A lot of times they come to events like this where there's tabling events, and they're gonna help get the information out. They're even subject matter experts in what they do and what they're talking about. However, they don't have a healthcare plan. That nonprofit can come in. The thing about a nonprofit is, depending on the size, they're going to get about 35% tax credit back. However, a nonprofit that is not ready to get onto a business shop plan can go through the individual and family program, which would be, again, a nonprofit going through the broker online or inviting us out to talk to their folks, to their volunteers and their employees, and we offer them individual health insurance plans, which is a phenomenal way to go for that. That means that each individual is going to have the opportunity to come into a health insurance plan and choose out of choices what's going to work best for their family out of the bronze, silver, gold, and platinum titles. So right now, through the American Rescue Plan, there's extra assistance, premium assistance, it's never been like this before. It's made things very affordable. The American Rescue Plan will be carried through 2022. And looking at it is, as we come back to work, what we want to see is, as some of those subsidies start fading out, we're going to have people that are coming back to work and employing themselves, or our small businesses are going to start picking up to where we can change the plan around and do other things with the healthcare plan. Just a little data here. The Bernalillo County alone has over 16,000 residents who could literally have a zero premium right now through the American Rescue Plan. And and about 200,000 New Mexican residents still are uninsured. And that's throughout the state. We're in Los Alamos, and I know that this is probably one of the most insured areas right now in New Mexico. It always has been. That's a good thing. That's a good thing. And you guys are all very healthy up in Los Alamos. You guys have awards and accolades for health, and that's awesome. What we need to do is from the Hill is kind of transcend that through New Mexico, right? Even myself. A lot of enchiladas and sopapillas. So let me give you an example of the American Rescue Plan, or the ARP. I'm going to just look at this because it's kind of cut off on the slide, but let's look at a 40-year-old. So a 40-year-old, under the old law, on a bronze, remember we talked about bronze, makes $40,000 a year. Under the old law, would be about his premium, he or she's premium to be about $219. Under the ARA and the American Rescue Plan, that's almost cut in half to $108. On a silver plan, the normal was $322, and now on the silver plan they'd be paying $211, $307 on the gold plan, and $196 on the under the new law. I was with a 59-year-old recently who left his job. He retired with no benefits leaving the job. He left. He was done working, so he retired himself with no benefits. 59 years old. We looked up single, and with his income, because it's based on a number in the family and his income, he was eligible for a bronze plan at about $369. And he went all the way, we looked all the way across at gold, between $500 and $600 for the gold plan. And again, so the bronze is the premium is lower, but there's more out-of-pocket costs when you're seen by a doctor or a specialist. On the gold plan, he would pay a higher premium to pay less out-of-pocket when he went to the doctor or a specialist. So those are just some real-time stories. Also recently had a gentleman whose wife passed away. She had the benefits. So him and his son were offered COBRA. So on COBRA, he was paying $1,000 a month for him and his son to have health care. And COBRA is very expensive. We got him onto through the New Mexico Health Insurance Exchange. He got a plan for him and his son, and is now paying $500 a month for health insurance for him and his son. Big difference. That's kind of for some people, $500 a month could be a life change kind of situation, right? We're here to help, more resources. I want to point this out here. Our 833-862-3935, option 3, we actually have a business engagement team that should answer that for further information. On the website also, you'll be able to find brokers closest to you, brokers in your area. If you don't, my card's going to be on the back. You can always contact me, and we'll help you search for brokers that are closer to you, or brokers who are very proficient in working around small business, or individual and family. Also, everything we do is bilingual. Most everything we have comes in English and in Spanish. We have bilingual outreach manager, and she's able to go out and do presentations. We also offer special incentives and health plans to Native Americans, our Native American population, wherever they live. Though most are under IHS, we always hear, well, I'm with IHS. IHS is a system. It's kind of like the VA, right? They provide health care through the system. What happens with some of those systems is they're funded on they're on the budget on a fiscal year. So towards the end, or as the clients come in or the patient comes in, they have to categorize what's more important. So maybe a wellness visit right now, especially, maybe a wellness visit, maybe whatever services are required aren't this priority. So what's available to our Native American population is a healthcare plan through BWellNM, where they can actually be seen by a physician or at a clinic in their local area, and they don't have to travel to an IHS doctor, or if that IHS person is booked all the time, they can actually opt into a health plan. And IHS also, it's a different pot of money. IHS will also get money from that, so that they don't lose the patient and they don't lose their clinic, because their clients are not visiting that clinic. You can also email business@bewellnm.com with more questions. Again, I'm going to have my card at the back. You can contact me anytime for deadlines, anything that's changing. I recommend everybody get a good look at the website. Take a good look at the bewellnm.com website. It's excellent. I encourage families and individuals to look at the BeWellNM website. I encourage small businesses to look at that. You just never know. You might have health insurance, but you might be around people that don't. And right now, we can't stress enough about wellness. We can't stress enough about our population staying healthy. We can't stress enough of keeping our employees healthy so we can stay open, right? I know it's been hard. One person gets sick, and then a cold just isn't a cold anymore. There's some processes that each individual business has, and state regulation, and above that's mandate what we need to do if somebody gets sick. So with that being said, I thank you again. It's been an honor and a pleasure to be here with you today. I hope that I've been informative. I hope that you reach out if you need. And yes, ma'am.
This is great information. Does anybody have any questions?
Yes, sir.
So I'm glad you covered nonprofits. I have a question about tax credits. So are these income tax credits since nonprofits don't pay income tax? What is the benefit to them?
The tax credit would be as same as a small business at the 50% rate. At 35%, they would get a return of 35% of what they paid into because it's a nonprofit. It will be at 50%. It's at 35%. And from the government, they would get a 35% tax credit, depending on what level they funded their employees at. And then the broker would be able to break that down.
Okay.
Actually, and there's a calculator that will calculate that on the webpage. That was a slide that we used to run, and then we don't run that anymore. So, but it's totally accessible on the webpage, easy to plug in and see what the tax credit return would be at a 35%.
Okay.
Any other questions? No more questions? Okay, fantastic. Again, thank you very much. It's been an honor and a pleasure to be here in Los Alamos, and anything that you need, we're at your service.
Thank you very much. So I want to just say thank you first to UNM for letting us return to campus here, and thank you for hosting us. I want to say thank you to Secret City Kitchen. If you didn't get any food, you should try it. It's fabulous. The Secret City Kitchen has a new owner, Robert Sayer, and he's doing a great job. This food is fabulous, so thank you to them. Thank you to Lionel CPO for allowing us to keep engaging the restaurants and supporting them with your sponsorship. So thank you very much, Patrick. And then thank you, of course, to Jean for being here with Pack 8 and recording. And we appreciate everybody that comes together to make these happen. So thank you. And thank you to everyone on Zoom for joining us. As most of you probably know, we still give out vouchers to the restaurants for people that sign up ahead of time and attend either by Zoom or in person. So those of you on Zoom, as long as I have your addresses, I will get one out to you. And those here in person, we've got some gift cards, and since you're here, you can pick one today. So thank you everyone for being here. Have a great day. We'll talk to you soon.